There we go.
There we
Sorry,
go.
guys.
Okay. Oh, okay, so anyway, basically that's the idea, that functional medicine would look beyond the initial kind of problem and try and find out, well, how can we put in all of the ingredients to solve this? And we've had lots of patients before who've either reduced their thyroid medication or even come off their thyroid medication once they look at kind of the whole picture. Another good one is hormonal tests, right? So if you went, thinking you might have a hormonal imbalance or perimenopausal or whatever, you might get a few little hormone tests done with your doctor. Whereas in functional medicine, and this is a great example of a test that can be really, really useful. It works for men and women. Probably the best test we have for women in perimenopause and menopause, because it looks like across all the different pathways. So starting at your adrenal glands and how you're producing cortisol, because your adrenals also produce your DHEA, which goes on to make all of your hormones. And then they break down into lots of little metabolites. It looks at your liver detoxification, which involves methylation and antioxidants and needs B vitamins, and your COMT gene, and that, is incorporating neurotransmitters. So it's just an example of how it's really kind of 360-degree looking at why your estrogen is high, as opposed to just measuring your estrogen in your blood on one day. So that's kind of the difference. I did want to put this up again. I'm not going to go through it now, but for people's at-home reference, because when you think of blood tests, you think of attending a clinic, you think of phlebotomy. A lot of people, that's not an option for. So there are at-home options, some of them pretty reasonably priced. So I wanted to put those in a bit of a table, just in terms of, and I don't know what way is best, actually. I mean, all of our functional medicine tests are listed on our website, but if anybody has any questions on what's available or what's available at home, I'm happy to answer them. The microbiome, I feel, is very much kind of functional medicine only. I don't think any really conventional medical healthcare professionals, apart from fertility doctors, actually look at the microbiome. And I think that's because we're not just looking for a pathogen. We're not just looking for a infection and then we have a antibiotic to solve that infection and then that's it, off you go. We're looking at how is this impacting all of your different systems. I mean, your immune system is really front and center when it comes to all of your different microbiomes, and how, as opposed to this idea I said within the slide at the start, that health isn't the absence of disease, it is, it's the journey towards wellness. So it's optimizing things so that your system, under functioning as it may be, can get enough support to work optimally. That's kind of what we're looking for. Again, not going to go through all of this, but wanted to put it in the slides because there's a couple of different tests that people will often ask, like, what's in that and is it useful and is it good? So I wanted to include information here on the organic acids test, really common one for people with like chronic fatigue to look at. Some GNA testing that people will often do. I would definitely recommend just running a commercial, 23andMe is gone, commercial DNA test like Ancestry or MyHeritage. Cheapest one you can find. I think MyHeritage sometimes is like 36 euros or something. And then using the really fantastic website, Genetic Life Hacks, to kind of glean information from that. And then looking at different kind of infection and exposure panels. Again, that's quite difficult to get out of a conventional medical system. Not very common for your doctor to run viral panels or Lyme tests. I'm happy to talk about those. Mold tests, heavy metals, things like that. So, I mean, I've just kind of thrown a load of words out there now and listed loads of different types of tests that are possible. Happy to go into any more of these in more detail or whatever, just whatever suits people. What I do want to say is, because people always ask this question, what's the best test? Like, what's the best test if I have long COVID? Or what's the best test if I have ME? And the answer is there's no one best test, sadly, because of course we don't fully understand the pathology, or like if we knew what the problem was, we'd try and go after it. But what I would say, and this goes for absolutely everybody, really try and get all and any of the medical blood tests that you can get out of, whether whoever's listening, the HSE, the NHS, whatever your health system is, like for the 30 euros or whatever they will charge you. Try and get your vitamin D, your ferritin levels, your B12, your folate. And remember that wellness is not the absence of disease. So we're not just looking for outright deficiencies and like just about being in the low end of the normal range. When things are not functioning well, we want to be up more like the top end of the normal range. So if your GP is saying, oh no, your bloods are fine, request a copy, look at the ranges. We don't want to be anywhere near the bottom of the normal range for things like B12, ferritin, vitamin D, the whole shebang. We do this quite regularly. We would review people's GP blood tests. It's the very first thing we ask people for. I would also recommend that everybody gets a full thyroid panel. Randox, Sarah Screen, gettested.io or whatever it is. There's lots of at-home test kits. Again, Randox is 36 quid. There's some information about, so your thyroid basically runs your entire metabolism. So again, if that is low normal, bumping that up a little bit if you can, giving it the support it needs. If it's out of range, then getting thyroid medication or treatment for it could really help things. And yeah, because it's like a cheap one. And sorry, there's a lot of like information coming out about how T3 is potentially an issue in long COVID and ME. So that would be my second one, just because it's reasonably priced and you can do it at home. And then after that, it's the kind of, well, you try and focus on the system that makes the most sense for you. So if you're having a lot of hormonal issues, or if you're having a lot of gut issues, or you feel like that's your weak spot, then that's where you go to next. Now, the other difference between conventional medical tests and functional medicine tests is that the reason they're much more advanced or they're much more comprehensive is because you have to pay out of pocket for them. So all of these things, not the little at-home test kits, that's what I'm saying, they're quite reasonably priced, but some of these tests, do carry a hefty price tag. That's why we try and focus in on, well, this area might give you the most kind of bang for your buck in terms of opportunity to make progress, to just optimize your health a little bit better. And what I want to say here is, and I know I put it on Twitter, is that I'm offering a free functional medicine test and like a follow-up consultation to kind of explain the results to you and go through it with you. And I have a register. One person will be picked out at random a month, and we'll get in touch and let you know. So please do register if you're interested in getting one of these tests for free. Okay, I'll stop talking now, and I'm happy to start the question.
Thanks so much, Ciara. Yeah, I mean, I think your point around requesting the test results yourself, I've come across that myself multiple times with people. My ferritin was, sitting right at the bottom, and I wasn't told about it, was told it was normal, and then 2 months later had really severe anemia and had to get an iron infusion. So it's really frustrating. And I remember the GP explaining to me that, the acceptable minimum ferritin of 12 or 13 is really set for kind of outliers like pregnancy and things. No one healthy, should be sitting at that point. And the same thing happened with my daughter twice. So yeah, I definitely echo that of always ask yourself, because and even then you can keep a record and just see patterns, I think can be really useful. And I know that the ferritin, but also the low neutrophils is one that people seem to be seeing a lot of at the moment, and kind of going up and down. Okay, so I had some questions submitted in advance, so I might just go to those first off. One of the questions I had actually, Ciara, was a bit of a random one. There was a patient in Northern Ireland, very severe, who's completely bedbound, and I was speaking to their carer, and they were trying to figure out how to get a multivitamin IV done, because it had some kind of positive response last time, and they have a family member who can actually administer it in the home, but getting it prescribed, they weren't sure where to go. And I remember hearing that there was a couple of functional medicine doctors here that had kind of in Dublin anyhow, that would sometimes go go down that route of kind of doing an IV vitamin. Have you any ideas for Northern Ireland where someone might start? It's a bit of a random one for you.
Yeah, now do prescriptions from Ireland work in Northern Ireland? I'm pretty sure they do, right? So you could technically see somebody online, here in Dublin or whatever, and then they could give a prescription to the north, right? So there's Fanula McHale.
Okay.
Lynn, you can feel free to jump in here, Lynn, if you're thinking of any better ideas as well. I know she gives a lot of nutrient IVs, she probably does online consultations, doesn't she, Lynn?
She may do. I feel like she might have changed her practice recently to be more aesthetics than functional medicine, although I'm sure she still does functional medicine. But yeah, she was exactly the person that sprang to mind, first of all. So yeah.
Yeah. No, it's expensive.
Expensive.
I mean, I feel like her consultations might have been 400 or 500 euros.
Wow. Okay. But it's a
Yeah.
good point that if they're having difficulty getting an NHS doctor to prescribe it, there might be a GP online service, even if not a functional medicine doctor from based in the Republic, that might see the person online and the prescription might work there. Okay, it's good to know.
Yeah.
Okay.
And then there's also oh my gosh, I had his name in my head now a second ago. Patrick McGovern. He's another
Yes, he was the
functional
person
medicine
I thought
doctor.
of, actually. Yes.
Also about 400 quid. There is an online EU doctor who, I don't know if they would prescribe it. They prescribed sodium cromolyn for our patients and things like that. They seem to be very open to suggestion. That is called Moby Doctor, MOBIDOCTOR, mobidoctor.eu. And it's 35 euros for a consultation, and you can get one like their thing is like next consultation is in like 2.5 hours or whatever.
Yeah.
So generally speaking, even if they don't do this, it's actually a really nice one for people to know about, because if you need an antibiotic for something or just something kind of, like a normal online, like what the health insurers do, those online doctors where
Yeah.
you don't really need to see a doctor, but they're 35 quid. And all of those EU
straightforward
prescriptions work everywhere.
Brilliant. Yeah. And also I think just to conserve energy sometimes, if you know what you need, the trip to the GP and the waiting and the exposure in the waiting room and all that, that's good 100%. To know. Okay, so some of these words I'm not going to have a clue how to pronounce. Given that many long COVID sufferers show signs of gut microbiome damage, low akkermansia, bile acid issues, low secretory IgA, how critical is microbiome restoration in long-term recovery, and what strategies do you find most sustainable?
Great question. I mean, it's really hard to tell how critical it is, isn't it? I mean, and I don't think we'll ever have that full answer, because what people seem to think is that, and this was actually the case like before COVID existed, that Lyme disease was kind of considered this way as well, that you can either, jump right in and take all of the treatments, or you can kind of prepare your body for the treatment. And we don't have, maybe it'll be anticoagulants, maybe microclots will be like the thing for COVID or whatever, but we don't have the treatment yet, right, for long COVID. But the idea that if you can get your body into an optimal position before said treatment, then we would see that in Lyme disease, that you would fare better from the protocol. And one of the biggest parts would be the gut. I mean, it has such a massive connection to it. So like 80% of your immune system surrounds your gut. So anything that's going in there, getting activated there, getting triggered, all of the things you mentioned, secretory IgA, inflammatory signals, all of that is going to have a massive impact on your immune system. It's connected to your neurotransmitters. We know there's problems with serotonin levels in long COVID patients. There's receptors in the gut that are supposed to absorb tryptophan. They think those are too low. Like, there's so much information on the gut, and the virus does infect the gut cells quite significantly. Even if you don't get gut symptoms in your acute period, you can guarantee that the virus has gotten in and kind of damaged your gut lining. So there's no way of saying for sure, and I would be loath to be like, well, everybody needs to do a gut microbiome test. But if you were kind of starting from a position of I don't know what to do first. I mean, I think in all autoimmune conditions that we deal with, for sure, when you say that, Lynn, that anybody comes in, autoimmune, chronic inflammatory conditions, anything to do with the immune system, immune-related infertility issues, were directly starting at the gut.
Yeah. Plus, other things to consider is that, as well as looking at the microbiome, looking at beneficial bacteria like Akkermansia, or looking for pathogens and things like that, you also get the intestinal health markers part of the test. And that's kind of really critical, because that lets you kind of interpret how the host, as in the person, is being affected by their microbes. And there's just no way you can see that without looking at a test. And you get really useful information, like I think that question mentioned bile acids. So that will let us understand how you're absorbing your fats and your fat soluble vitamins. It'll tell us, what your pancreatic elastase is like. And sometimes, we'll pick up really low levels of that in people. And if that's really, really low, they're not going to be absorbing properly. You won't have the raw materials for energy, all of that kind of aspect. So it's such a big knock-on effect other than actual gut symptoms. So I think the decision for deciding to do tests might not necessarily be only based on, is that the location where you're having the symptoms? Because it's so far-reaching,
Mm-hmm. Yeah,
that makes true.
Okay. What are the most effective ways you've seen to support autonomic nervous system dysfunction in long COVID, such as vagus nerve dysfunction or parasympathetic issues, outside of the typical POTS-focused treatments?
Yeah, really difficult, really difficult. And actually, I don't know if I made this abundantly clear at the start of my previous webinar, because I had a couple of chatted to a couple of people afterwards that I had long COVID, right? So I had it for 3 years and doing a lot better now. So I've tried a bunch of these things. I spent €700 on a Neurosim because I was absolutely desperate. So that's the vagus or the tragus clip-on thing. I've since now, it earned its money. I've posted it around to about 20 people and they posted it back. So at least I shared it around. But I mean, it was a moment of desperation. Did it work? Not really. I burnt my tragus. I don't know. Like, there's loads of different things you can try. I mean, maybe the easiest one to do is yoga nidra, because at least it's free and you can do it when you're lying down, every single day or as often as you like. I don't know if I've any. I don't think we know really. Some people will, and obviously Neurosim is has been clinically tested and things, so it works for some people, but I don't think it worked for me. I don't know if it's worth €700. There's also the Sensate, which is a little bit, isn't it Sensate it's called, the little pebble one that you stick on your chest. That's about 200. One of them, there's another one that I'm missing the name of now. I think they had a kind of a return situation where if you didn't find any benefit from it, you could return it after a month. I would be able to get the name of that because I know my friend Kirsty used it and I can't think of it now. But at least then you're not forking out a lot of money, because I mean, all of these things cause money, and it seems to be such a trial and error scenario. So I unfortunately do not have a better answer to that one.
Yeah, that's it, isn't it? You can so many things you could spend money on and energy, and it's kind of figuring out which the best investment. There's someone looking for a beginner's guide to gut repair in simple steps.
Because there is any amount of different like supplements that you could take or that kind of thing. Even when we're in clinic, we're always trying to like, no, we just simplify this, or we just have our favorite, 5 supplements that we use. And then you get talking to somebody and they say, well, I've tried this before, I can't take that and I can't take this. So every single person ends up leaving with a different supplement schedule. Definitely. I think we spend the vast majority of our time actually tailoring somebody's supplement protocol based on their feedback or funds or whatever it might be. So I suppose people would think of something like L-glutamine, for example. That was probably the biggest thing for gut, like a leaky gut repair, like 5-10 years ago. But there's loads of people who would react negatively to L-glutamine because of the whole glutamate toxicity. So I tend to not start with that now. I think from a very general, something that everybody could probably do is taking out things that are making it worse, right? So taking out very inflammatory foods, potentially things like gluten and dairy. It's not to say that that's, you know, going to solve everything, and it's not to say that everybody is celiac or gluten is the devil or whatever. But if you were starting from a what's the most simple thing for everybody to try, I think it's getting a clean diet insofar as you can, and putting in lots of different colors and diversity. Now, when you have absolutely no energy and your carer is looking after you and the household and the kids and whatever else going on, I mean, my diet was shocking. I'm a nutritionist. My diet was terrible when I was so sick because someone delivered me a ham sandwich on white bread. That's what I ate, you know. So you know, this is all ideal world scenario. If you can eat lots and lots of fruits and vegetables, lots of different types of fibers and spices and things like that, all of those will help your beneficial bacteria. And effectively, we have a symbiotic relationship with our beneficial bacteria. So they give us lots of good stuff and we allow them, you know, we feed them and whatever else. But if we give them the food that they like, they will kind of produce all these lovely short chain fatty acids that help heal up your gut. So I feel like food is a way that everybody could start. And then, you know, but then if, you know, then you're talking about things like fermented foods are great for your gut health. But if you have histamine issues or MCAS, you can't be eating those. So everybody is quite different. And then I think we all know as well, even something as simple as, well, not simple, but like something like a good probiotic, people can react differently to those too. So I don't know if there is a one size fits all.
Sure. And around you know, that's so important to kind of make that point around the practicalities. So obviously, as you say, with really, you know, the more severe end of the spectrum, if someone's willing to, you know, send over some food, you kind of eat what you're given. And then also, I think as someone, I've really struggled with nausea in the past as part of my illness. And I think, you know, when you're feeling really nauseous, it's like whatever, it's kind of being pregnant again, whatever you can kind of stomach. But in terms of cutting out something like gluten and dairy to kind of see if there's a benefit, I remember a few years ago, I was kind of told 21 days was the kind of the time frame to kind of see if there was any change. What time frame would you recommend in terms of, you know, maybe stopping dairy and seeing?
Well, that's really to see if you have an intolerance. So that would be like what we call it, like an exclusion and challenge type thing. So if you think that you're getting digestive issues or a skin rash or a sinus complication or whatever from dairy, you would take it out fully for 3 weeks. And then you do your challenge, right? Where you would eat like a yogurt and a glass of milk and a bit of cheese all in one day for 3 days. And if your sinuses flare up, there's your answer, right? That's it. And it's actually a really good way to figure out food intolerances. It can be more, it's more accurate than the food intolerance IgG tests that you get at a pharmacy or whatever. So that's to figure out if you're getting an actual reaction from it. But if it's something as kind of deep down as well, it's triggering some very underlying chronic inflammation, you're not feeling it, you're not seeing it, but it's disrupting your immune system, then I'd be thinking more like 3 months at least.
Okay, that's good to know. That's the difference there. Okay, just a couple of, I'm just moving back to the chat then temporarily to pick these up. So someone is asking, they're in Northern Ireland, and how would they go about getting a hormone test?
Okay, so that Dutch test, albeit in the 400 euro bracket. So I just wanted, like, I always feel so bad going, this test is amazing, but also it, you know, costs 400 quid. But it is very doable at home. So it's a dried urine test. It literally will get posted to you. You do it at home. You just like pack it into a little envelope and then post it back to, it goes to the US. So that is something that is an at-home, very easily accessible, gives so much information. And it's definitely gut microbiome, Dutch test are probably my 2 most favorite tests, because that was the test where I was like, and it goes all the way from your adrenals to your hormones to your liver to your methylation to your neurotransmitters. Like, there's just so much information in it. And cortisol is a pretty big factor in long COVID and ME and fatigue. So there is quite a lot of information in that test. So yeah, okay. That one is pretty
good to know. And then regarding conventional inflammatory markers, CRP and ESR, what, if anything, would you recommend through diet to reduce to normal levels? So I suppose you've mentioned there the idea of trialing gluten or dairy exclusion. Is there anything additional?
Yeah, so I mean, an anti-inflammatory diet, generally speaking, has much more omega-3 fats and much less saturated fats, because those literally get turned into inflammatory molecules. So your omega-3 fats will get turned into anti-inflammatory molecules, and your kind of omega-6s and saturated fats can get turned into more pro-inflammatory molecules. So trying to get your oily fish in, difficult enough if you have histamine issues, because the easiest way, especially for fatigue point of view, is to be eating tinned fish and vacuum packed. They're always in your closet. You know, you're just opening the pack, they're pre-cooked, like they're great for fatigue, terrible for histamine issues because they're all aged and everything. So then you're looking at getting things like fresh salmon and fresh mackerel, or fresh sardines. Who gets fresh sardines in Ireland? Nobody. So yeah, trying to get more fish, and then somewhere in the middle is kind of your plant-based. So if you can go more plant-based, and that's good for fatigue, because you can batch cook those and get them in the freezer. And when I say you, I mean you or whomever is cooking. And they come out of tins. So tinned chickpeas, tinned lentils, you know, tinned beans, all of those kind of things are really handy. And then less of the red meat, processed foods, sugar, I mean, all the things that we know are kind of bad for us. That would be considered an anti-inflammatory diet. And we would do that kind of thing a lot, and it can be really, really effective. And then actually going down the gut microbiome route as well. So all of those polyphenols and colors and spices and fruits and veggies, the more of the stuff you get in there, the more those short chain fatty acids will be produced by your bacteria, which also impact your immune system. But those are really good markers to follow. So they don't show up for everybody, and they're very nondescript. So CRP could be coming from anywhere, right? The needle in a haystack can be coming from a tiny infection in your toe. It could be coming from, you know, bursitis, could be coming from anywhere. But if you can get them repeated by your GP, because if they're out of range, that allows them to repeat them. Like there's all these little rules that they have to follow. Like if your TSH isn't out of range on a thyroid test, they're not technically allowed to repeat that for you. But if your CRP or your ESO are out of range, they are allowed to repeat that. And going back to what you said earlier, Sarah, on the tracking, you know, so if your CRP is going from 5 to 8 to 12, like you are moving in the wrong direction, and there is something going on in there. We want to see that coming down to the direction.
Okay. And what kind of time frame would you be pushing the GP to repeat that?
I mean, so you don't want to ask too much, right? So you have to pick your battles, but I would be saying like 6 weeks, you should see a CRP turning around and coming back down. And if it's still going in the wrong direction, you want to be looking at where is this going from and what's happening.
Okay. Good to know. Someone's asking, do you do consultations with people in the US?
We do. I have quite a few patients in the US, yeah.
Fantastic. What's the best test for mold sickness in long COVID patients, and what treatments do you recommend for tackling mold?
Yes, mold is a really tricky one. And I still have question marks over mold testing, right? Because what you're testing there is these toxins that the mold have produced that you've then ingested or breathed in or whatever. And they've gone through your liver and your kidneys and things, and they're coming out in your urine. So one of my questions has always been, okay, well, if you have high levels on that, then you're definitely exposed from it, right? It hasn't ended up in your urine from nowhere, but you definitely have mold somewhere. Now, whether that is causing your symptoms or whether you're actually just a really good detoxifier of it and you're actually getting rid of it really well, rather than the person who's kind of maintaining it all. So that always kind of made me wonder. And then the second part is, if you do have high levels of mold toxins in your urine, then where is it and where is it coming from? And I mean, I feel like unless you're in a new build that has, you know, what do they call that when they suck all the air out of your house and it's fully sealed or whatever, there's definitely mold in your house. Like there's definitely, and if it's a little bit older, I mean, there's 100% mold in your house. Like I don't know if you've ever replaced your bathroom, or you know, bashed out a sink, or taken off the tiles on your splashback in your kitchen. You know, there's always mold. Wherever there's water, there's mold. And then obviously you know, our houses can get quite damp and there's a lot of rain in Ireland. So depending on how much you have and whether you can find it and whether you can afford to completely remediate your house, which sounds like it would be extraordinarily expensive. But if you can see it, then getting rid of it is step one, right? So reducing your exposure is step one. So if there is mold growing on your windowsills or in your bathroom, or if maybe changing bedroom to the warmer side of your house and not the gable end wall, or one of those kind of things, that's possible. There's also those dehumidifiers that you can buy. They actually work quite well to stop the mold kind of continuously growing. Making sure that your bathroom has good ventilation, all of those kind of things. None of those are easy solutions. You can buy agar plates. I think we bought the they're like, I can put up the link if we need to. They're potato starch, I think. You buy them on Amazon, they come in a pack of 10, and you basically leave them in your suspect spots. You take the lid off, and then you leave them in a room for 4 hours without going in, because what you want is kind of all the mold spores to be settling on those plates, not being blown around in the air. And then you put the lid back on, you let them grow in a warmish place, like it's a bit like proving bread or whatever, in a warmish place for 7 days in your house. And you will see colonies growing, which, you know, can freak you out, but we do live with microbes all the time. And around 3 or 4 is considered like, yeah, there's some mold, but anything above 4 or 5, there's a lot of mold spores in your area. And if that's like right beside your bed that you're in all day, you might consider what you can do with
Wow,
your
I didn't know,
room.
I wasn't aware of that. That's really, yeah, I think people would definitely be interested in that. Like
Yeah, so that's quite cheap. Yeah, they're like
yeah.
15 quid.
And I know there've been people who've even trialed kind of, you know, heading off to their mothers or something, you know, or a family member and living there for a few weeks to see if it makes a difference. Because I know
Yeah.
I've definitely spoken to a few people who feel that they're better off when they're in a different climate, you know, better off out of the Irish climate. So it sounds like a complex one, unfortunately.
Yeah.
So there's a question here: if I need to take a probiotic for good health, how long is needed to be taking them? I imagine that varies.
It does. Lynn, do you have any, do you want to jump in there?
Yeah, so I suppose it depends on a lot of things. Ideally we'd like to see what's going on in your gut, maybe just to assess, you know, how low is the beneficial bacteria kind of starting off, and that might kind of guide us in, you know, what needs to grow to kind of bring back to good health. I would say like at least 3 months, at least, if not 6, you know, depending on what's going on. But also remembering that like the probiotic is just the bacteria. You know, you also want to be thinking about putting in the substrate or the fuel for that bacteria as well, in terms of prebiotics and fiber and things. And we also want to think of polyphenols as well, which is like a little bit of a fertilizer for your microbiome. So not thinking of probiotics on their own, but thinking of it as a kind of a, how do we make the whole environment grow? And, you know, I wouldn't be thinking about it in isolation. But yeah, it's really hard to say, yes, take them for a month and they will do X. It's, are we looking at any symptoms that you're trying to improve? What was your microbiome like to start off with? You know, have a big history of antibiotics? Is there any pathogens in there that are kind of competing for space and stuff like that? So yeah, you'd be thinking about all those things too.
Okay. And actually, just on that, I suppose I know, Ciara, you've mentioned before, like that, if you're not doing the test in advance, you may be adding something that you don't need to be adding. So I suppose I'm thinking of someone like my son who hasn't had any testing done, and we've been kind of throwing some Alpha-X into him because it was the one we were told to have him on, because with his PANS, he'd kind of had periods of prolonged antibiotic use. I mean, is it better to hold on that until you get the test done? Could you be doing more harm taking a random probiotic, or you know?
Probably not after an antibiotic. I mean, that's
Okay.
just kind of fairly prudent. If you've taken an antibiotic, try and help restore. And bearing in mind that what you're trying to do there is like favor the environment for your growth. So when you take a lactobacillus, like that's in Alpha-X or whatever, they don't necessarily go in there and implant and then they grow, right? So they don't really persist they just go in there, they release their little positive particles and they make the environment better for your own bacteria to kind of bounce back, because that's really what you want. After an antibiotic, you're supposed to get back to your own status quo. So you just need like a little bit of help in that matter. So I think it's a good idea after an antibiotic that you wouldn't just be like, oh, well, I'll just wait and get a test done now and see. You would just go ahead with a probiotic.
Okay.
But I think it's if you've been randomly trying probiotics for years on end, then absolutely you could be wasting your money on the probiotics rather than finding out something useful to work on. Yeah.
Okay. Someone here is finding that their nose is running when they're eating. Any thoughts on where that might be coming from? Or I wonder if it's an MCAS thing or something.
Like histamine issues. And I think, histamine issues, as I'm just calling them, it's a really big scale, right? So you can have really, really mild outward symptoms of it, but actually it's contributing to your fatigue or your poor sleep or like the things that you kind of think are bigger, but that can be contributing even if you're not getting hives all over or headaches after eating or whatever. But if you're getting anything that you're getting after eating is clearly responding to something that you're putting down into your digestive tract, and bearing in mind that anything that goes in there is interacting with your immune system, so your immune system is then triggering and running your nose. Definitely sounds like it could be something more specific, like a food intolerance to dairy, or something along those lines. But I probably go broad histamine ? First, just because it's so common in long COVID.
Yeah. Okay, so someone here is asking about infections. So she says, I'm sick relentlessly with new viruses and COVID and reinfections since long COVID, which flares up the long COVID symptoms despite still masking and mostly being at home. If I wasn't sick constantly, I feel like I get to a stable baseline, but this never happens. My immune system seems extremely damaged. I've been to an immunologist and a rheumatologist, and my bloods all show as fine. What would you recommend?
I'd love to know what kind of bloods they did.
Okay.
Because and again, sometimes I don't know how people get these like who are the doctors out there that are doing the more advanced immune tests, and why can't they all do them? I don't know. So for example, and this again was something that has been seen in post-viral conditions prior to COVID, it's common in Lyme disease, is something like an NK cell suppression. So after the initial infection, your immune system just kind of tanks and doesn't rally itself for whatever reason after. So you get this kind of long-term immune suppression. Now, again, fertility clinics have been measuring NK cells for like 20 years. They're kind of light years ahead in some ways in kind of functional medicine, whereas you'd go to an immunologist and you wouldn't get your NK cells tested. Like, it doesn't really make sense, I feel like immunologists are definitely look for, I bet you she's had her IgA, IgG, and IgE measured. So they measure your overall levels of antibodies. And if you don't have a deficiency in those, like they wouldn't be giving you IVIG or anything like that. But looking at all of the individual cell types can really help. We have an immune panel. We had it for years because we used to do it for fertility patients. Now we use it all the time for post-viral issues. And what we use is things like medicinal mushrooms. So depending on which kind of subset of immune cells is like inactive or reduced, then we use different types of medicinal mushrooms to increase those. And they can be really helpful. I will say, it's more difficult in post-viral conditions than it is in fertility because of, the underlying cause, let's say. But that's where we would go. And obviously we'd have a nutritional base to try and boost your immune system. But I don't think there's very many medications that you could take even for low NK cells. No, I don't think there is that. Yeah.
Okay. Will a doctor look at the results of a Dutch test when it comes back? Like, will they accept it?
Most of them, I would say, like, I suppose typically we would have been sending them to maybe I suppose GPs and menopause specialists and things like that. I think they've been fairly well received, Lynn, don't you?
Yeah, if it's been used, let's say, for a menopause client, let's say, who is doing the Dutch test to inform, certain aspects about their HRT, and for example, we might see that their testosterone is low, or we might see that their progesterone is low despite having the coil in, you know. It can help guide those sort of decisions. And I've definitely had GPs who have taken that on board for their patients, for sure. Yeah.
Good.
And
Now,
adjusted their medication for it or
adjusted their
whatever.
medication. Now, we'd always accompany it with, you know, a letter of explanation, etc. But yeah, generally they would be quite well received. Actually, most of the tests that we do would be quite well received by doctors once we cover everything off with a letter and explain everything. I haven't, I really had any issues in that respect.
That's good. That's good to know.
Yeah.
Which fish oil would you recommend to increase omega-3?
Well, I suppose dosage wise, you want to be getting like at least 500 milligrams of EPA and probably somewhere similar on the DHA. So, or thereabouts, up 700-800 of the actual omega-3 rather than the fish oil, let's say. I think, I'm trying to think, what would you say, Lynn, is your most favorite kind of cleanest product?
I do like Wiley's. I feel like it's one of the highest, but it's in the oil. So obviously that's not ideal for some people. So Wiley's, or I would often use the Natural Health Practice one. There's 2 grams of overall omega in that. I think probably around 700 or 800 EPA and DHA in that as well.
Yeah.
And I like the pure encapsulations one as well, even though I think it's a little bit lower in overall levels, but
it's not bad for a one a day.
For one a day, yeah.
Yeah, the NHP is a 2 a day, but it's actually probably priced pretty much the same.
Yeah.
Yeah, that is a good clean product. They're a very good clean supplement company, generally speaking. They do put peppermint oil in their omega-3 capsules to try and offset kind of the fishy flavor. However, some people react to peppermint oil.
Yeah. Yeah, they get peppermint burps instead of fish burps.
Or a combination of the two.
Or a combination of the two, which is delightful. Yeah.
Okay. Do you come across a lot of patients with long COVID with high ferritin levels? My son averages about 800 to 1,000, no test before to compare.
Yes, I mean, this is actually one of my little favorite subjects. So hemochromatosis or iron overload is really common in kind of Western Europe. It's probably the highest, I think, in Ireland and maybe like Finland or something. And it's quite easy to notice on a blood test if they would, get it measured. So this is one of the other reasons why we would always want to look at GP blood tests. So first of all, you're looking at your ferritin. So if you are a male who's eating, 2 portions of red meat per week, and your ferritin is 100 to 150, that's probably pretty normal. If you're a female who mostly eats chicken, might nibble on a steak, once a month, and you're menstruating, your ferritin is probably going to be about 30, which is not enough, right? So you want it to be up around 100, 80 to 100. However, if you're a female and you mostly eat chicken and you nibble on a steak once a month and your ferritin is 280, technically that's still in the normal range and your GP won't even mention it to you, but it is way too high. It does not make sense. So what's happening there is now, and hemochromatosis looks at 2 specific genes in a pathway that involves at least 12, right? 12 different things. So your iron getting absorbed into your gut, getting into the cell, getting transferred through this blood, then getting into your cell, blah, blah, blah. So there's loads of different steps along that pathway that kind of could be hyperactive so that you're absorbing way more iron than you expect. And it's building up in your liver cells and inside your macrophages, and then eventually what happens is it accumulates in your liver and your joints, your fatty tissues, and you start getting a lot of inflammation and a lot of joint pain and things like that. And it should be caught way, way earlier than that because it's really easy to deal with. The thing I definitely want to mention is ferritin can be quite confusing though, because it's also an inflammatory molecule. So it will go up in the middle of inflammation. So if you have a COVID infection, if you have an infected toe, whatever it might be, your ferritin can rise. So what we always need to look there is for the whole iron studies. So your serum iron, and really important, your transferrin saturation. And there is a trigger. So within there, if your transferrin saturation is over 45 or 50, depending on the lab, that is a trigger that it needs to be repeated. It needs to be done on a fasting sample, needs to be repeated in a couple of weeks. And sometimes it's just not picked up. So we've had patients before with their transferrin saturation is 65 and nobody's noticed and haven't gone back in for repeat tests. And that could be iron overload very, very easily. So what I would say there then is years and years ago, people used to be told, right, you might have iron overload. Now they'll send you for a genetic test at least. You might have an iron overload and you need to stop eating red meat. No, they don't give you any dietary advice. They just go, sure, let's see what happens. Come back to us when your joints hurt or whatever. I don't understand it. So you definitely need to be reducing the iron in your diet. There's a couple of different ways you can reduce iron absorption, like taking calcium with your meals, even drinking black tea with your meals, not taking vitamin C, for example, which helps iron absorption. There's a couple of different ways. You really need to try and avoid red meat if you can. And then giving blood or, getting blood taken, whether it's not even going into the donor pool or not, is how it's managed. And I had a patient before in the north of Ireland who said, yeah, no, I have hemochromatosis. I get my bloods done every 6 months. And when I go above 110 on my ferritin, I go and I give blood and I drop right back down to 50. And it's been this way for 20 years and I'm fine. And I was like, I've never heard a patient in the Republic of Ireland get that kind of treatment.
No,
but that is the way to do it and not keep it going until it's causing problems, what?
Okay.
Yeah. So 800 or 1,000 would concern me.
Yeah.
Would be okay. Since someone's asking, if you donate blood, will that bring it down with diet? And obviously just to remind people that GiveBlood.ie and the UK as well, you're not permitted to donate blood if you have long COVID symptoms. The same with ME.
You should be able to donate it that doesn't go into the donor pool. Is what I mean.
Okay.
Yes, like you're getting a blood draw as opposed to
therapy.
donation.
Yeah.
Yes, exactly. Yeah.
Okay. Yes, that makes sense. Is there a non-fish fish oil for the omega-3? It's just, maybe she means a synthetic or
algae based.
Okay.
Yeah.
It's for vegans,
yeah. There's a good few. I think Cytoplan have one, Norsan have one. I think Wiley's have one as well now. There's a few out there. Yeah, they're algae based ones.
Okay, good to know. Do you recommend pine needle tea for reducing spike? I'm not sure. Does that make sense to you?
Like the spike protein type thing?
I'm thinking that's what they're meaning.
I actually don't know. I haven't heard that one myself, but we'll certainly look it up after this.
Okay.
I've heard of it, but I couldn't say whether it's effective or not. But yeah, I have heard of it.
Okay. Do products like EC3 work for mold? I'm not sure.
No, I don't know what EC3 is either now. Is that I'm sorry, I don't even know whether we're talking about a supplement or
no problem. Hopefully the person might comment.
Sorry, I didn't really answer that question though, in terms of like obviously getting rid of the mold was part one, but helping your body detoxify the mold is kind of part two, right? So and that's kind of that's really all you can do, whether you're taking a chelating agent so that it binds onto some of those toxins to take it out, bearing in mind those chelating agents like charcoal and zeolite and all those will also bind medications that you're taking, other supplements, minerals that you're trying to absorb, a bunch of other things. So just to be cautious around them, taking a whole load of chelating agents for a long period of time has knock-on effects. And then depending on the specific type of mold, so if it's aflatoxin or whichever one comes back, your liver will use different pathways to help break those down and get them out of your body. And then you can potentially take like things like N-acetylcysteine or glutathione or whatever to help that liver pathway work better and get those toxins out of your body. So that's kind of part two of mold detox.
Okay. I think EC3 is modified carbon in construction. So it's an environmental thing. So I think we will maybe come back to that one by email. Okay, just have a quick look. In cases where long COVID overlaps with low testosterone and dyslipidemia, low HDL, altered triglycerides, do you see patterns of endocrine disruption that need to be specifically addressed for better recovery outcomes?
Do we see patterns of endocrine disruption? Say that again, sorry.
Yeah, patterns of endocrine disruption that need to be specifically addressed for better recovery outcomes.
If I was starting with the low testosterone, I'd be certainly querying that. That definitely sounds a little bit like more along the medical side of things.
Okay.
And I don't know if that person has had any luck with an endocrinologist and whether they're taking all of those things into account rather than, well, we'll replace that. Like, why is the testosterone low? Is there, as you say, kind of an overall depleted endocrine function? Lynn, have you any thoughts there?
Wonder, is the person male or female? Do we know?
I believe male.
Male. And age, I suppose, as well. You know, the younger person or an older person.
I believe 40s, 30s, 40s.
Okay. So yeah, I'd be asking the question, why is it low in the first place? And kind of basing the route of investigation on that. You know, is there low amounts of, raw materials to make sex hormones? Is there, as I said, different crosstalk disruption with the other endocrine organs? That's kind of what you'd be looking at. I think maybe that's what the person who asked the question means, is it?
Your guess is as good as mine.
Okay.
So many of these words are all new to me.
I suppose when you say endocrine, it can refer to thyroid, it can refer to sex hormones, it can refer to stress hormones. Do you know what I mean? And they all kind of communicate with each other. So I suppose it's looking at everything as a whole. Yeah.
Yeah, and I suppose that's one thing you could do in terms of looking at like the HPA axis, looking at your adrenals, your cortisol, your thyroid and everything. But then I suppose from the medical point of view, you'd be thinking of the signals that are coming from your brain, like your pituitary and all of those kind of things. So I suppose there might be a bit of a, if there has been if all of the brain signaling part has been ruled in or out, then yeah, you would probably go down to, okay, well, what's happening with the endocrine tissues then?
Okay. I'm conscious of time. Are you ladies okay to stay for 5 minutes and just, okay, amazing.
Yeah.
Thank you. So how important is mitochondrial support in your long COVID protocols? And are there particular supplements or therapies you see helping most consistently without causing overstimulation?
Yes, I think they're really, really important. I don't know if it's very difficult to measure, how much damage has your mitochondria suffered and how can we get them to kind of regenerate or create kind of mitobiogenesis, so it's very difficult to say, yes, and then we took these 4 supplements and we made our mitochondria work better. However, I suppose you're kind of going by people's symptoms there, right? So are they getting a bit more energy or resilience out of the day? I think that most people would take mitochondrial supplements for that purpose, like to just optimize what they can get out of a day. I think that things like CoQ10 have been, overall probably reasonably successful for people. I think there is definitely issues with utilizing it, whether it's absorption or different brands, different reactions to brands. It's quite expensive and dosage and everything, but it can be one of those things that even if you've tried one brand and that hasn't worked for you, you might actually have to try a different one or a different type or a different dosage, and that kind of goes for a lot of them, which is awful. I do think things like N-acetylcysteine and glutathione in terms of an antioxidant to protect your mitochondria, I think people have found pretty decent effects with those. And sorry, just on the CoQ10, then you kind of go up on there's the kind of better versions that are even like €300 and whatever else. And that's all well and good, but how you can afford those month in, month out, I don't know, but generally just general CoQ10 is somewhere to start. And then things like, I suppose it's not necessarily the mitochondria, but what I think of is the resource. We've talked about this a lot, like the ingredients that the mitochondria need to produce ATP. So in theory, that all comes from our food, right? So we eat it, we're supposed to be getting glucose, amino acids, and fatty acids, and they all go towards your metabolism and eventually ends up in your mitochondria to make ATP. That's a very simplified way of saying it. But are you eating those right foods? Are you digesting those foods down into their simplified forms in order to get it to your cells because we're also depleted in energy, that even digesting, absorbing, and transporting requires ATP. It's almost like you're kicking yourself in the foot before you've even started. So can you get food or supplements into you that are like, they're called pre-digested, right? But they're like the simplified forms. So I was tweeting about this a little while ago, actually. The elemental diet is used for SIBO to almost give your digestion a rest when you've got a bacterial overgrowth. But it makes quite a lot of sense for people that just don't have the energy to even digest or absorb properly, or all of that. So to take things like simplified amino acids, maybe even glucose, obviously in a small dose, right? We're not talking about like packets of sugar. Things like simple oils and things, if you can tolerate those, so that your body doesn't have to use up energy in order to get the ingredients to your mitochondria to provide the energy. And those simple amino acids can kind of bypass a lot of the previous metabolism, go straight into what's called your TCA cycle. I like to call it like a water wheel, that as it goes around, it's producing energy. And your amino acids can go right in there and fill up those buckets and try and get that water wheel to go a little bit better. So trying out all them, I think bulk.com have very, very reasonably priced, like 100-gram packets. Some of them are like 5 and 6 quid. So you can try them out. Start at low doses, because Lord knows somebody will react to everything, particularly things like glutamine. But getting an essential amino acids mix, citrulline, arginine, taurine, lots of people have had really good success with that. There's loads of different ones that you can try, and then you can kind of come up with a bit of a mixture that's reasonably priced, but it's like a easy to digest, like a shake or a smoothie, but that's like giving you kind of almost like instant energy. So it's not solving your long-term problem, but I think mitochondrial supports like that are your daily support, rather than, we don't know whether they're curing anything really.
Okay. Have you ladies come across much use of DHEA? Because it's something that I was put on a long time ago by one of the consultants in this country treating ME and long COVID. And for me, it triggered ovarian cysts, and I've come across a couple of other women in the ME world, the long COVID world, who've had this effect, and apparently it is a known side effect. Have you come across much about it?
Well, I mean, did you have your hormones tested beforehand, and were you low in testosterone or estrogen, for example?
No, they didn't test.
Yeah. So, I mean, that's what it's great for, right? So
Yeah.
your DHEA basically turns into testosterone, which turns into estrogen and feeds all of your hormones, right? So when you're low in those, I mean, it can be great, it's absolutely fantastic. But if you're not, I mean, what probably happened there was that you already had plenty of estrogen, and then they just gave you something that boosted your estrogen really high and then triggered ovarian cyst growth. And it could really feed
Yeah.
fibroids and all sorts of
An
other
interesting
problems.
one, because I was also reading that many women with ME and long COVID can also have estrogen dominance problems. And so it's back to this kind of thing of throwing a lot of things and seeing what sticks, but obviously sometimes you can throw something and it ends up causing an additional problem. So it's,
Especially
yeah,
something like DHEA or like, I feel like that was a risky one, you know.
yeah, yeah.
So that again, that going back to the Dutch test, because it's really fascinating the way, you know, all of those hormones are kind of interconnected and how you're breaking them down. So for some people, and hormonal symptoms, I mean, if you were to throw up 20 on a list now, half of them, you know, you could attribute to low estrogen, and the other half you could be like, well, they could easily be high estrogen, or, you know, they're all the same. Everybody gets kind of the same symptoms from very different patterns of hormones.
Yeah.
So, and you can also have like normal-ish estrogen but sky high progesterone. That's kind of the difference between those two that will give you things like hot flashes and things. So you'd think, God, I seem menopausal, but my estrogen level is normal. But it's like the difference between the two levels of hormones that is causing
More
the
complex than
imbalance.
that.
Yeah.
Yeah.
And then you have to detoxify all of those hormones, or effectively, this sounds like a simple way of putting it, but it's like they build up in your system if you're not getting rid of them. So you could be producing an okay amount, but if you're not getting rid of it on a daily basis, it can have a pretty big cumulative effect. So then you go and add in more hormones, or on the flip side, there's a supplement called DIM, that a lot of people will try randomly.
Yeah.
And it's an amazing supplement, right? But it reduces your estrogen levels by basically increasing the detoxification pathway. And I always feel like it's like pulling the plug in the bottom of your estrogen pool. So if you started out with quite low estrogen, that's going to cause pretty big problems. Like we would never use DIM without
Not without
seeing
testing.
a
No.
dust test first.
No.
There's some things you don't want to mess around with them unless you know what's actually happening. Yeah, it's a good point. I might
Especially in
just
women over like in their early 40s or late 40s
Sure.
when estrogen can be starting to drop off. You just wouldn't use it blindly.
Yeah, makes sense. I'll take two ones I hope are quick, and then I'll let you ladies go. Is there an obvious histamine test?
No. Short answer, sadly, no. We used to do them. We used to do histamine and DAO, I think we were measuring, and it just wasn't very accurate. And then people would come back and we'd be like, we have your results. You know, they're normal. They're like, well, I've just been on low histamine diet for a month and I feel amazing. So
yeah.
So no, they don't reflect. And I have obvious MCAS patients who get them done and they come back normal, and so sadly the answer is no to histamine.
And even the DAO supplements can be a little bit hit and miss in terms of they're not a magic result for everybody, but they work really well for some people. So yeah.
Okay. And then lastly, for the at-home microbiome test, is there a recommended one? And I suppose how would people know if something is worth the money and trustworthy?
So there's a bunch of at-home microbiome only where you're just looking at like your bacteria or whatever. And the best value one and probably the most trustworthy or whatever is BiomeSite in the UK. I think that's still only about 150 euros or something. However, it doesn't look, as Lynn was mentioning earlier, all the digestive markers that on that. And I know the other test is more like 450 quid, so it's much more. But without the add-on information, I almost don't know where to start here, because I don't know if your gut is really inflamed. Like we've had people who have complete red flag scenario, like they come back and their calprotectin, which is their inflammatory marker, is off the charts, and they have to go for colonoscopy, or they have, something has to be done about that first and foremost without doing anything else. And they don't have any symptoms or whatever. So having that extra bit of information really makes the protocol worth it. We use In Vivo Diagnostics. They're a UK-based company, and I don't think they ship to the US or anything like that. In the US, we use Vibrant to do a test called Gut Zoomer, which is excellent. There's loads on it. Or there's Genova, or who's the other one? Doctor's Data.
I feel like I haven't used that.
GI Map.
Genova. Oh, the GI Map. Yeah,
maybe not the Doctor's Data one. But those are the companies we use. But those other ones that include all of the markers are all in the 400 or 500 bracket.
Okay, perfect. Well, I think we've got through a huge amount there. Thank you so much. I feel like my brain is trying to process all this information.
I know, and it's all a bit scattered as well.
It's so frustrating. Yeah, the memory issues. But that's why we have the recording, thank goodness. And just to remind everybody of Ciara's new pro bono service, where she's seeing a new patient every 3 to 4 weeks, and you can register your interest with a link, and we'll be sharing that link on our socials and on our website over the next couple of days if people are interested in that. Anything to add, Ciara?
Yeah, just on that I've been meaning to get that up and running like this entire year, basically. So I mean, I wouldn't say I'm 100% recovered, but I'm 90% or whatever, 95 from about January. So this was my idea back then, and now it's almost May. So my plan was to do one a month. So like I'm definitely going to do 2 this month is what I was going to say there, because I feel like I've been waiting so long to get it sorted out. So I will be picking out the first name, like I guess in the next week, and then maybe I'll just give it another couple of weeks for more people to join or whatever, and then pick out another name just straight away after that. So any of those tests that we've talked about today, they're up for grabs. Obviously things like phlebotomy, being near our clinic, being able to blood draw, that's not necessary you don't have to do any of those tests. There's lots of at-home options, and you can, I can get in touch or whatever, and we can see which one might be, like we said earlier, the best bang for your buck, the best piece of information for you. And then I'll go through the test results with you in an hour consultation online. So it can be, I think, anywhere in the world, right? I mean, most of our patients are Ireland, UK, Europe, US. I think I've had a patient from Australia, but I actually don't know if we can do, then can we do tests in Australia? Like just logistically wise. I'm definitely on
I don't know.
Ireland, UK, EU, America.
Yeah.
Logistically wise, other countries might be
tricky. Yeah.
Okay.
Well,
and
we can
anyone
do
registered
the Vibrant Wellness.
Say again?
Okay. Not
Sorry,
just Ireland, then you're happy for other people outside Ireland to register.
Yeah.
Perfect. Okay. Fantastic. Well, thank you so much. I really appreciate you coming back and answering all these questions. Yeah, really, really informative. Appreciate it.
Thanks a million, Sarah. You're great.
Thank you.
Thanks so much.